You need to know what happens to a man's body, mind, and intimate life after prostate surgery. If you're over 50, you know that prostate health is more than a medical concern. Prostate health is a key part of wellness that impacts everything from your physical comfort to your relationships. If you're over 50, you know that. In today's video, we'll explore the effects of prostate removal surgery ranging from urinary health and sexual function to emotional challenges and the role of supportive therapies. If you haven't yet, if you're not a subscriber yet, please subscribe and enable the notification bell so you don't miss any updates. Your support means a lot to me. If you enjoyed this video, you can help me continue sharing valuable lessons by liking and sharing it. When faced with a difficult prostate diagnosis, whether cancer or benign prostatic hyperplasia, men are often presented with several treatment options. Among them is prostate prostatectomy, a surgical procedure that involves partial or total removal of the prostate gland. Prostate cancer. This choice is a powerful step towards recovery of your physical health. However, it's essential to understand that this decision carries far-reaching implications that extend beyond the operating room. For many men, the idea of a prostatectomy is not just about undergoing surgery. It is about facing a future where their sense of normalcy and independence may be challenged. This choice is filled with both the hope of recovery and the weight of uncertainty about the quality of life. One of the most common and challenging side effects after prostatectomy is urinary incontinence, a condition that for some feels like an incredibly personal loss. This is not simply a physical symptom, it is a reminder of vulnerability and change that can affect self-esteem and comfort. The degree of incontinence varies widely. Some men experience small leaks that may occur when coughing, laughing. In these cases, the condition can be a nuisance and uncomfortable, but manageable. However, for others, urinary control may be much more difficult to maintain, with more pronounced and frequent leakage requiring absorbent devices or other measures. The emotional cost of adapting to this new reality of feeling the impact of this change during what were once the simplest moments is significant. Suddenly, everyday actions require new planning and reflection, and a man's independence can feel diminished. Medical studies indicate that nearly half of men who undergo prostate surgery will face some degree of incontinence. Prostate surgery leads to incontinence in at least the initial recovery stages. While these statistics offer some comfort by showing that others share the experience, each journey is unique and personal. This can lead to feelings of isolation and questions about the future. My life from now on will be different. How do I handle this emotionally and physically? These questions are difficult, but they reflect the very real concerns that accompany such a profound physical change. Despite the challenges, many men have a strong sense of resilience and determination as they navigate recovery from incontinence. Recovery is possible, and although it often requires patience and commitment, the body can show remarkable strength in response to focused rehabilitation. Many people on the road to regaining urinary control need to do pelvic floor exercises. These exercises are an essential part of a larger recovery process. These exercises are more than a physical routine. They represent a form of empowerment and an opportunity to reclaim a sense of control and dignity. Perform these exercises regularly to gradually strengthen your pelvic muscles. This will help you regain control over time and regain a sense of autonomy in your daily life. The road to recovery is not always smooth or linear, but each small improvement brings a new spark of hope. Men find themselves one step closer to feeling like themselves again. This journey is marked by courage and is a testament to their resilience as they face the physical, emotional, and psychological impacts that often accompany support from family. Friends, and support groups are vital in this process. They offer understanding and encouragement, which help lighten the load at the end. A prostatectomy can change many aspects of life, but it also reveals inner strengths you may not have known you possessed. This is a reminder of the human spirit's ability to adapt and overcome even profound change. This journey is difficult, but it has the potential to grow resilience and a new appreciation for life's simple moments and victories. Every man who goes through this experience becomes a testament to his strength by demonstrating that he is more than his diagnosis and that he has the power to reclaim his life, one step at a time. Changes in sexual function are another significant consequence of prostatectomy affecting many men physically and emotionally during the procedure. It is almost impossible to avoid affecting the delicate nerve structures that control sexual response, particularly the ability to achieve an erection. These nerves are close to the prostate, which makes them vulnerable during surgery. Despite advances in nerve-sparing techniques designed to protect these nerves, the risk of erectile dysfunction remains significant, especially as men age. For older men, the risk is especially high. Studies show that sexual function before surgery and age play critical roles in determining the impact. For many men, the idea of losing sexual function feels like losing a central part of their identity. Intimacy and connection are deeply ingrained in our self-perception, and the physical limitations that may arise after surgery can feel like a profound personal loss. It's clear that more than just physical function is at stake. The secondary emotional effects, changes in confidence, and the need to readjust expectations are just a few of the issues that men face. Fortunately, sexual rehabilitation therapy offers a path forward for many. This therapy may include specific exercises, medications, or supportive devices designed to help regain sexual function. These tools don't just help physically, they also help men rebuild their sense of masculinity and self-esteem. Masculinity and self. The journey to regaining sexual function requires patience, courage, and a willingness to relearn intimacy. Working through therapy or adapting to medications requires vulnerability, a willingness to confront change, and the development of a new form of trust. Sexual function recovery may take time, and new ways to maintain it may be discovered. Masculinity and self-esteem. The journey to regaining sexual function requires patience and courage to relearn intimacy. Working through therapy or adapting to medications requires vulnerability, a willingness to confront change, and the development of a new form of trust. For some, recovery of sexual function may take time, or they may discover new ways to maintain intimacy and closeness with their partner. This path reminds us that true intimacy can extend beyond physical acts by offering a renewed sense of connection and emotional depth that may not have been fully appreciated before undergoing a prostatectomy. Undergoing a prostatectomy in later life also presents its own unique set of challenges. Aging bodies generally heal more slowly, and the ability to regenerative capacity decreases as we age, which complicates the recovery process. Older men considering this surgery should approach it with an understanding of these additional obstacles and with comprehensive advice from healthcare providers on what to expect. Older patients should be fully informed of the risks associated with their age and any pre-existing conditions, such as heart disease, hypertension, or diabetes, which can exacerbate the effects of surgery. These coexisting conditions can complicate the procedure itself and the recovery period, making the experience exhausting. If you are still watching this video and find these lessons useful, please comment on number 1 below. Older patients should be fully informed. Surgical risks increase with age. Comorbid conditions, such as heart disease, hypertension, or diabetes, can complicate the procedure and recovery. This experience is exhausting physically, mentally, and emotionally. If you are still watching this video, please comment below to let me know. For those in their golden years recovering from a prostatectomy, it is a journey marked by resilience. It requires careful consideration, preparation, and understanding of one's physical limits. Every step forward and every small victory represents strength. Older men may face a longer road to recovery, but the support of loved ones and the guidance of compassionate medical professionals can make all the difference. Healing is not only a physical process but also an emotional one. Older men may face a longer road to recovery, but with support from loved ones and guidance from compassionate medical professionals, they can find meaning and purpose in their lives, even through the most challenging circumstances. Mobility issues can significantly impact a man's ability to participate in essential rehabilitation exercises after prostatectomy, aimed at improving urinary continence and sexual function. Prostatectomy affects the body and mind, and for many older men, these limitations can amplify feelings of frustration, anxiety, or even grief as they cope with changes that alter the way they perceive themselves. They experience urinary incontinence and difficulty maintaining a satisfying intimate life, which can have a profound impact on self-esteem and sense of masculinity. These changes disrupt aspects of life that many men associate with their emotional weight. For men who see sexual function as a key part of their identity, losing some or all of that capacity can feel like losing a part of themselves. It is common for men to experience a wave of complex emotions when they confront these changes. These emotions include feelings of inadequacy, shame, and isolation. What used to be sources of joy and connection may now seem distant or full of worry. This can put a strain not only on the relationship with oneself, but also on the relationship with one's partner. When the body does not respond as it used to, men may feel like they have lost some of their agency, which adds another layer of emotional recovery that requires as much attention as the physical. Fortunately, therapeutic interventions offer a glimmer of hope. Studies show that sex and couples therapy can be powerful tools to help men and their partners navigate these changes. Through therapy, men and their loved ones can explore new ways to experience pleasure and intimacy by cultivating a shared understanding that deepens connection even in the face of physical limitations. These therapies provide a safe space for both partners to express their feelings, address insecurities, and rebuild intimacy in ways that may not have been considered before. They reframe intimacy as a mutual experience that goes beyond physical performance by nurturing an emotional closeness that can be incredibly rewarding. Plus, a strong support network is essential for a holistic recovery. A strong support network fosters an environment of acceptance and encouragement that can profoundly uplift someone going through a transformative experience. Knowing that there are people who genuinely care, who understand the ups and downs, and are there to lend a listening ear or a helping hand is essential for a holistic recovery. This can make all the difference. Emotional recovery as much as physical rehabilitation requires patience. Every day is an opportunity to rebuild a new sense of self and remember that healing is a journey. Healing is not about returning to the life you knew. It is about redefining your identity, strength, and purpose in new and meaningful ways. For many men, the journey after prostatectomy becomes a testament to courage. It shows that strength lies not only in physical ability, but also in the heart and mind's ability to adapt, embrace, and thrive no matter what challenges life presents. There are many ways to reduce the possible adverse effects of a prostatectomy. Men can recover and regain a sense of normalcy. Comprehensive rehabilitation is key. It addresses both physical and sexual health by providing men with tools to improve their quality of life after surgery. There are many ways to reduce the possible adverse effects of a prostatectomy. Men can recover and regain a sense of normalcy. Comprehensive rehabilitation is key. It addresses both physical and sexual health by providing men with tools to improve their quality of life after surgery. Physical rehabilitation begins with a focus on strengthening the pelvic floor. This is a comprehensive area to regain urinary control. Tailored exercise programs, such as pelvic floor exercises, help strengthen the muscles that support continence. This allows many men to make significant progress over time. For those who may be skeptical about the impact of these exercises, physical rehabilitation focuses on strengthening the pelvic floor to regain urinary control. Tailored exercise programs, such as pelvic floor exercises, strengthen the muscles that support continence, allowing many men to make significant progress over time. Studies have shown that pelvic floor training can lead to substantial improvements, offering men a sense of empowerment and control in their recovery. Along with physical rehabilitation treatments to improve sexual function, these exercises play a vital role in helping men navigate life post-surgery. The possibility of erectile dysfunction after prostatectomy is daunting for many men as it can profoundly impact self-image, confidence, and relationships. There are various options designed to support sexual function and intimacy. Medications that promote blood flow to the penis, such as phosphodiesterase inhibitors, can help men achieve and maintain an erection. They feel more natural and help with intimacy. Vacuum devices create an erection by drawing blood to the penis. This option may seem intimidating at first, but it's effective. Vacuum devices effectively address erectile dysfunction by increasing blood flow to the penis. Many men find this option effective and comforting, allowing them to reconnect with their partners and maintain intimacy despite physical challenges. However, changes post-surgery extend beyond physical function, affecting desire and interest in sexual activity. This decrease in pleasure is related to reduced testosterone levels, a condition more common among older men and those who have undergone extensive surgery. Hormone therapy can revitalize energy levels, mood, and sex drive. Hormone therapy is not without risk, however. Men should consult a specialist to evaluate whether this treatment aligns with their overall health profile. When hormone therapy is appropriate, it can help men reclaim a sense of vitality that supports not only sexual health but also overall well-being. Hormone therapy is not without risk, so men should consult a specialist to evaluate whether it's right for them. When hormone therapy is appropriate, it can help men regain a sense of vitality that supports not only sexual health but also overall wellness. This, in turn, adds to the resilience required for a full recovery. Deciding to undergo a prostatectomy is a deeply personal and often complex decision that requires thoughtful support and honest discussion with healthcare providers. Every man's journey toward this decision is uniquely shaped by personal values. Men should know that surgery can be a valuable option for managing serious prostate conditions. However, it is crucial to understand that prostatectomy is not the best option for everyone. Men should carefully consider factors such as age, general health, and personal goals, as they can greatly influence both the experience of the surgery and the recovery process. When deciding whether to undergo prostatectomy, it is essential for men to consult with physicians who provide thorough, compassionate, and transparent information regarding the risks and benefits of surgery. Honest conversations with medical professionals allow men to see the big picture, preparing them not only for the immediate effects of the procedure but also for the recovery journey. Empowerment through informed decision-making is essential for many men in this process. Men need to understand their options and know that they have an active role in their treatment. This alleviates feelings of powerlessness and fear. This sense of agency is incredibly empowering. It reinforces their ability to navigate the decisions ahead of them with confidence. Making the right decision depends on medical advice, listening to intuition, and understanding needs. Men must understand their options and know that they have an active role in their treatment. This will alleviate feelings of powerlessness and fear. They will feel incredibly empowered when they understand their ability to navigate the decisions ahead with confidence. The right decision depends on medical advice, intuition, and understanding needs and values. It's a balance between the science of medical care and the art of living well. Each person must take an active role in determining what recovery means to him, beyond clinical and personal decision-making. The emotional dimension of recovery is equally vital. A network of support that includes family, friends, and healthcare providers can provide encouragement, empathy, and understanding as men adjust to life after surgery. Recovery means finding a balance between science and art of living well. It means taking an active role in determining what recovery means to you, beyond clinical and personal decision-making. A network of support is vital. This includes family, friends, and healthcare providers. They can provide encouragement, empathy, and understanding as men adjust to life after surgery. Recovery often involves overcoming physical obstacles, but it also requires emotional resilience. Men may face unexpected emotions as they adjust to changes in their physical capabilities. These emotions may include frustration, sadness, or even grief. A network of support helps buffer these feelings by creating a safe environment where men feel understood. Recovery entails surmounting physical obstacles, but it also demands emotional fortitude. Men may encounter unanticipated emotions such as frustration, sadness, or even grief as they adapt to changes in their physical abilities. A network of support mitigates these feelings by establishing a secure environment where men feel understood, valued, and encouraged. The emotional support of loved ones can nurture a sense of hope and motivation by reminding men that they are not alone on this journey and that their identity transcends any physical limitations. If you are still watching this video and find these lessons useful, please comment on number 2 below to let me know that you are still watching this video with me. In addition to personal support, therapeutic interventions can be transformative, such as sex and couples therapy. Therapy is offered to men and their partners. It provides a structured and empathetic space to address any concerns. Therapy can help men and their partners address concerns, fears, or expectations around intimacy after surgery. Therapy helps couples explore new ways of connecting by deepening their emotional bond and opening doors to intimacy that go beyond the physical. In these sessions, couples can learn to express their needs openly. They will learn to care for each other and foster a level of closeness that may even surpass what they experienced before. For men who struggle with self-esteem or masculinity after a prostatectomy, therapy offers an invaluable opportunity to rediscover a sense of worth by learning that intimacy is multifaceted and that its value is not only defined by physical capacity. Men who struggle with self-esteem or masculinity after a prostatectomy therapy can rediscover a sense of worth by learning that intimacy is multifaceted and its value is not only defined by physical capacity. The journey of recovery after prostatectomy is a testament to the resilience of the human spirit and a reminder that healing is an emotional process as much as it is a physical one. The journey of recovery after prostatectomy is marked by small victories, whether through rehabilitation exercises, therapy, or reconnecting with loved ones. This process reclaiming life, strength, and purpose. While the road is challenging, it presents an opportunity to adapt and grow. This journey not only restores a sense of control over one's life but also fosters a deeper appreciation for connections. We know that rehabilitation exercises, therapy, and reconnection with loved ones represent a victory and a reclaiming of life, strength, and purpose. This journey restores a sense of control over one's life and fosters a deeper appreciation for the connections, support, and inner strength that guide them through life. We are dedicated to providing transparent, supportive, and practical information to empower people to make informed and conscious decisions about their health. We understand that facing a prostatectomy may seem daunting, but it is by no means an end to the vitality and fullness of life. With proper care, emotional support, and tailored rehabilitation, a prostatectomy can be rich and deeply rewarding. Our commitment is to guide you in reclaiming a sense of trust. We know that our deep commitment will be rewarding. We are committed to guiding you in reclaiming a sense of trust, well-being, and intimacy that honors each individual's journey. Our content is designed to offer knowledge and encouragement, as well as support in embracing each step forward with hope and resilience. We recognize that no two cases are alike, and that each person's journey has its own challenges and triumphs. We are dedicated to helping you understand, grow, and empower yourself. Remember, a fulfilling life is within reach, and together, we can make it a reality. Thank you for joining us on this journey. Empowerment. We know you now have the information you need to navigate life after a prostatectomy and embrace a healthy, fulfilling lifestyle. We want to hear from you. What is one thing you have learned from this video that will inspire you in your life? Share your thoughts in the comments below. Continue the supportive conversation with us. If you enjoyed this video, leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel. Your support means a lot to us and helps us to bring you more valuable content.